Hello friends, welcome to my channel. Today I will be discussing the disorder of the thyroid hormone, and mainly it is a hyperthyroidism. So in a hyperthyroidism or thyrotoxicosis, the important causes of these are Graves disease, Graves disease, and another one is a toxic nodular goiter. And then there is a thyroid storm, which is a thyrotoxicosis crisis. It is an emergency. Now what happens in Graves disease? Graves disease में क्या होता है? The antibodies IgE antibodies, they are formed against the TSH, and they are going to stimulate this TSH. This is going to act on the thyroid gland, and that is going to cause the release of T3 and T4. इसकी बढ़ जाएगी. And but there is a negative feedback, so level of the TSH will be low. And in Graves disease, there is a axophthalmos. That is because of the antibodies they are attached to TSH receptor, which are present in the orbital tissue. Now in toxic nodular goiter, this is a less common, okay, mostly seen in elderly patient. इसमें क्या है? Irrespective of TSH stimulation, the T3 and T4 level, they are more. Not in elderly, ये बेटा काट दो elderly. So T3 and T4 level, they are more irrespective of TSH. And orbital symptoms, eye symptoms इसमें नहीं होते. इसमें क्या है? The non-toxic goiter, sometime that is changed into the toxic goiter. ठीक है. And third one is a thyroid storm, or which I say thyrotoxicosis crisis. उसमें क्या है? In thyrotoxicosis crisis, it happens because of the decompensated hyperthyroidism. So it is an emergency. You have to treat it vigorously. Now for hyperthyroidism, what drugs we have, or how we are going to classify antithyroid drug. So we have ionic inhibitor. This is number one. Then we have a thioamides. These are the thioamides. And then we have iodide and iodine. And then we have a radioactive iodine. Now how this group of all these drugs, antithyroid, how they are going to act, what is their mechanism of action. So to make you understand how these drugs they act, you must know how the T3 and T4 they are synthesized. So here I will be giving only outline of this. In my first video I have told in detail about the how this T3 and T4 how they are synthesized. Here I will be telling in briefly. So if you want to see in detail, I will be giving the link of that video in the description box, so you can go and watch that video too. So how this T3 and T4 they are synthesized, there are total 5 steps. So you can see here also 1. Then number 2 is behind my photograph. Number 2 is this. ये वाला आपका number 2 है. Then another one is this is number 3, number 4 and number 5. So first step is there is a iodide, and this is a single follicular cell. ठीक है, ये आपका single follicular cell है where this is formed. This is a luminal side. ये आपकी luminal side है. And this is a basal side, और इस side पे आपकी ये क्या है? This is the blood vessels. So iodide from the diet, this is taken up by the cell with the help of this ट्रांसपोर्टर, ये वाला ट्रांसपोर्टर NIS, sodium iodide symporter. This is going to transport this iodide, dietary iodide within the cell. Then it is going to cross this luminal membrane इधर जाके with the help of pendrin, and this iodide it is converted or it is oxidized into iodine. So पहला step iodide uptake, second step is oxidation. Now once it is oxidized, iodide से आपका iodine बन गया, then this inorganic iodine it will be, it undergo organification. Now what happens in organification? Organification में, and this oxidation it requires this thyroid peroxidase enzyme. इसमें ये वाला आपका thyroid peroxidase enzyme, this also participate. And this thyroid peroxidase enzyme, where it is present? It is present on this luminal side. ये जो आपका brush border है ना, यहीं पे आपका ये blue color का जो दिखाया, here only thyroid peroxidase it is there. So this helps in the oxidation. Then after the oxidation, the organification of this iodine, how it happens? It binds with the tyrosine, amino acid tyrosine. और tyrosine इसको कहाँ से मिलता है? Tyrosine, that is the structural component of this thyroglobulin. ये structure बनाई मैंने thyroglobulin की. You can see the various type. This black आपके ये वाले, फिर से I will draw it with the black only. This ये जो लंबे लंबे डंडे ऐसे बना, this shows the amino acids, and here round, this is the tyrosine. And this iodine it binds with the tyrosine. अगर एक लगा है, then it is going to form the monoiodotyrosine. You can see here monoiodotyrosine. And if there are two iodine, they are going to bind with this 1 and 2. Then it is going to form the diiodotyrosine. And one monoiodotyrosine and diiodotyrosine, they are going to form this T3. And two diiodotyrosine, they are going to form the T4. This process it is called coupling. So third is coupling, and all these oxidation, organification and coupling, they need thyroid peroxidase enzyme, and this whole thing will be there within the lumen as a colloid, pink color colloid. And when the body needed, whenever there is a TSH stimulation, then what will happen? The release will happen. And how the release will happen? This whole thing, thyroglobulin, इसके साथ आपके अमाइनो एसिड है, the DIT, MIT, T3, T4. So you can see here all these thyroglobulin है, T3, T4, MIT, DIT, they enter within the cell by endocytosis. And with the help of this lysosomal enzyme, what this lysosomal enzyme does, it causes a breakdown of this, and there is a release of T3 and T4. This is step number 5. Then what will happen? This to DIT and MIT, the iodine it is again reutilized here, and in the periphery, thyroid follicle, they mainly synthesize T4. T4 synthesis is more in comparison to T3, but it is a T3 which is an active hormone as compared to the T4. So in the periphery like liver and kidney, what happens to this T4? It gets converted into T3 with the help of deiodinase. Hope you understood this. Now the different type of drug which I told you in the this. Now the first one, ionic inhibitors, how they are going to act. यहीं पे लिखा हुआ, they are going to inhibit the iodide trapping, this thiocyanate, perchlorate and nitrate. What they are going to do? So they are going to inhibit this trapping. They act by inhibiting this step rather, inhibiting iodide trapping by inhibiting this sodium iodide symport system. They are going to block that. So by acting that, it is going to give a right. So by acting that, it is going to block the iodide uptake, the very first step which is required for the synthesis of this T3 and T4, that is blocked by ionic inhibitor. We have thiocyanate, we have perchlorate and we have nitrate. But nowadays this group of drug it is not used because of the toxicity. जैसे अगर मैं nitrate लेती हूँ, it is going to cause methemoglobinemia and various vascular effect. Then we have this perchlorate, they cause the bone marrow toxicity, and bone marrow toxicity is with the thiocyanate, perchlorate, aplastic anemia, agranulocytosis. Because of these side effects, this group of drug, it is not used nowadays. Okay. Now the second group of drug, that is thioamides, ये वाले आपके, sorry. So second group of drug is thioamides. इसमें आपके आते हैं propyl thiouracil, carbimazole and methimazole. So methimazole, that is a active form of carbimazole. So carbimazole, it is a prodrug. Once you give the carbimazole, it gets converted into methimazole. Now how this group of drug they are going to act? They are going to inhibit, यहीं पे लिखा inhibit the hormone synthesis. Now how they are going to inhibit the hormone synthesis? They are going to act on further 3 steps. Now what are those 3 steps where this group of drug they are going to act? So they are going to inhibit the oxidation, आपका ये वाला, they are going to inhibit the oxidation, ये वाला, this step. So this step number 2, step number 3, that is organification, and step number 4, that is coupling. So they act by inhibiting the action of thyroid peroxidase. By that it is going to inhibit 2, 3 and 4. 2 क्या है आपका? Oxidation of iodide to iodine, ये पता होना चाहिए. Then organification, that is a binding of iodine with the tyrosine. So organification. And then the third step is coupling. So it is going to inhibit all these 3. Now we have 3 drugs. Out of that, propyl thiouracil, carbimazole and methimazole. So carbimazole and methimazole, I told you, methimazole, that is the active form of carbimazole. So in our country we mainly use the carbimazole. Let's see the basic difference. So mechanism of action I have told. So we have a propyl thiouracil, right? So I'll be telling the this one only. It is a less potent, more bound to plasma protein, less plasma half-life, 2 to 3 hours. Then less transfer to placenta, and it is going to inhibit the peripheral conversion of, sorry, यहाँ पे peripheral conversion of T4 to T3. So this is the basic difference between propyl thiouracil and carbimazole. Now carbimazole, that is half life, it is कितनी है carbimazole की? Carbimazole half life is 6 to 10 hours. So OD काफी होती है इसमें. It does not cross the placenta. Sorry, it crosses the placenta. So we do not give it during the pregnancy. And there is a peripheral conversion. It is going to inhibit the peripheral conversion, whereas carbimazole, that is not going to inhibit. So carbimazole, it is more potent, less bound to plasma protein. It can cross the placenta and it is not going to inhibit the peripheral conversion. So in our country mostly we use the carbimazole. ठीक है, हम अपना कार्बिमेजोल ही यूज करते हैं ड्रग. So carbimazole, this is very commonly used except during pregnancy because of the less transfer, and then in thyroid storm where we do not want where we want to inhibit the peripheral conversion of T4 to T3. So these are the 2 conditions where we prefer propyl thiouracil Otherwise, in all the condition we use carbimazole. But nowadays they say even during pregnancy, methimazole, that is also a safe alternative. So this drug, where we are using it as an antithyroid, we are using it in the दो conditions मैंने बताई आपको. एक ग्रेव्स डिजीज बताइए, one is a grave disease and another one is toxic nodular goiter. So in a grave disease अगर आप पेशेंट को देते हो for 1 to 2 years, यंग पेशेंट है, ग्रेव डिजीज का, grave disease in a young patient, and there is no cardiac problem, no angina, no CHF, then what will happen with the carbimazole for 1 to 2 years, if you are going to give, 50% of the patient remission will be there, and then you can stop the treatment. And again if the symptoms appear and you just reinstitute, फिर से पेशेंट को आप वो मेडिसिन देना शुरू कर दो कार्बिमेजोल. This is in a young patient. Now if the patient is having any cardiac disease, Graves disease, change the color, इन एल्डरली, अगर एल्डरली को हो गया है एंड विद CHF, एंजाइना, इनमें अगर हो गया, देन वी अगेन कैन पुट द पेशेंट ऑन कार्बिमेजोल. इसमें भी हम दे सकते हैं पेशेंट को सेम. हाँ, अगर देन अनदर थिंग इज इफ द पेशेंट इज हैविंग टॉक्सिक नोड्यूलर गोइटर, अगर ये वाला है, इसमें क्या है, द रिमिशन इट इज नॉट दैट कॉमन along with the antithyroid drug or carbimazole. इसमें you have to, if the patient is young, अगर तो young patient है उसमें तो आप सीधा go for the surgery. If it is a elderly patient जिसमें कि CHF और angina भी साथ में या नहीं भी है, तो जिसमें, और in a young patient अगर कोई surgery की कोई contraindication है, then how to go about with the toxic nodular goiter, क्योंकि यहाँ पे आपका अकेला carbimazole it is not going to work. So here what we are going to do, हाँ, patient को you give the carbimazole to make him a euthyroid, थोड़ा सा euthyroid देके, euthyroid बना के, then put a gap of 1 to 2 week and then give iodine 131. ठीक है. Then again after a 1 week gap, again start with the carbimazole and withdraw this one over a period of 3 months, because iodine 131 ये आपकी लेती है near about 3 months to show its action, and it results in a partial ablation of the thyroid gland. So this is another alternative in the elderly patient. This is how we give this antithyroid drug to the patient. ठीक है. तो सर्जरी के इफ द पर्सन गो, इसमें क्या है, इसमें ये है कि जो भी सर्जरी के साइड इफेक्ट हैं, that is not, there will be no damage to recurrent laryngeal nerve, no removal of, गलती से भी parathyroid gland which is behind the thyroid gland उसके पीछे होते हैं, तो we won't be removing that also perchance by mistake. And then sometime what happens with the thyroidectomy, the person becomes hypothyroid and it is it's totally irreversible and the whole life patient has to take थायरॉक्सिन T4 उसको लेना पड़ता है. सो ऑल दीज कॉम्प्लिकेशन वी कैन अवॉइड, द सर्जरी की जो भी हैं, वी कैन अवॉइड बाय गिविंग द एंटीथायरॉइड ड्रग बोथ इन द ग्रेव डिजीज एंड इन द टॉक्सिक नोड्यूलर गोइटर. दोनों में से किसी में भी आप ये दे दो. एंड इन इफ द पेशेंट इज हैविंग एल्डरली पेशेंट है, उसमें भी अगर ये वाले है, उसमें जहाँ पे ये वाला कार्बिमेजोल काम नहीं कर रही, एंड यू कैन गिव द another drug along with that. Then the third group of drug. So इसमें सबसे ज़्यादा important side effect क्या है with the carbimazole? Hypothyroidism. Hypothyroidism can happen and sometimes patient has to take T4 for a long time. And then if the person takes during the pregnancy, अगर pregnancy में दे दिया, then the fetal goiter, that is very very common. चाहे हम ये है propyl, that's why we prefer propyl thiouracil, because otherwise this can cause the fetal hypothyroidism or the clinical manifestation of that is called a cretinism that may happen. Now the third group of drug is iodine or iodide. So iodide अगर आप ये देते हो, it will be also iodine अगर आपने दी है, iodine gets reduced into iodide. So iodide ही ultimately. So this is the one which inhibit the hormone release. आप देते कैसे हो, iodide of sodium and potassium, then organic iodide and iodine. अब देखो iodide भी दे रहे हो और iodine भी दे रहे हो. So iodine it gets reduced in the intestine to iodine. तो आपने इट इज गोइंग टू एक्ट ऑलमोस्ट इन एट ऑल द फेसेस, सब जगह पे ये काम करती है. इट इज गोइंग टू, अगर आयोडाइड ज्यादा हो गई, ये वाला अमाउंट ज्यादा हो गया, दिस वन फर्स्ट, इफ दिस इज मोर, ये वाला आपका ज्यादा, इफ दिस इज अ मोर आयोडाइड आपने ले लिया आयोडीन, देन व्हाट विल हैपन, इट इज गोइंग टू इनहिबिट दिस ट्रांसपोर्ट ऑफ, यहाँ पे करेगी, देन इट इज गोइंग टू इनहिबिट व्हाट, ऑल दिस स्पेशली द ऑर्गेनिफिकेशन, इसको इनहिबिट करेगी, कपलिंग को भी इनहिबिट करेगी. Then this endocytosis, this is also inhibited, and the most important is, this is the most important is its release. ये सबसे important है. So iodine and iodide they are going to act almost everywhere, but this is the most important. ये सबसे important है, यहाँ पे ये सबसे ज़्यादा importantly it is going to inhibit the release. तो इसमें क्या है, once you are going to give, what will happen to this. Sorry, one point I forgot to just tell about the, I'll take up later on. So this is the most important step. It is going to inhibit the release of T3 and T4 in the peripheral circulation. So this step it is called as, it is going to cause the thyroid constipation. Constipation होगी, वो आप release नहीं कर रहा, it is not going to release the T3 and T4. And once you are going to give this, this is a very potent, very fast acting antithyroid drug, the gland become firm, the gland become less vascular, and if you want to do any surgery, thyroidectomy करनी है, तो आप patient को पहले ये दे दो, so gland become firm and less vascular, so that surgery become easy. But इसमें क्या है, after 10 days the escape, the thyroid escapes happen. What will happen, ये constipation वाला जो है, it will again, there will be release of T3 and T4, synthesis will be there, again there will be release, will be the short acting action है इसका. So we can use this one along with the other. आप इसको कर सकते हो, like I told you, pre-operatively you can use it before the surgery. लेकिन before the surgery if you are going to use this, then सबसे पहले आपने क्या करना है, suppose you are planning the surgery, first give the patient this carbimazole. अगर आपने सर्जरी करनी है, suppose you are planning for thyroidectomy, give the patient carbimazole. Carbimazole से make the patient euthyroid. Then give iodide for 10 days to make the gland form less vascular, so that the surgery become easy. Up. Then you can give even propranolol. It is going to, जो भी उसके sympathetic stimulation के जो भी symptoms हैं और thyroid से related hyperthyroidism की वजह से, it is going to take care of that. It also inhibits the peripheral conversion of T4 to T3. So all these are given pre-operatively if you are planning for the surgery. So iodide, it is used for that purpose. Very commonly use of this iodide. Okay. Even for the now, what are the side effect with this? This iodide, it is, if the person is sensitive, then it can show the acute reaction as well as the chronic. Acute reaction में क्या होता है? There will be swelling of lips, swelling of the eyelid, फीवर हो जाएगा, पेशेंट को जॉइंट पेन हो जाएगा, थ्रोम्बोसाइटोपेनिया हो जाएगा, लिम्फेडेनोपैथी, दैट ऑल दैट कैन हैपन इन अ एक्यूट रिएक्शन. वेयर इज अ क्रॉनिक ओवरडोज में क्या होता है, विच इज कॉल्ड एज आयोडिज्म. सो विद द क्रॉनिक ओवरडोज इट रिजल्ट्स इन आयोडिज्म. इसमें भी आपका स्वेलिंग ऑफ आईलिड और उसमें एंजियोडीमा ऑफ लैरिंक्स एक्यूट रिएक्शन में, दैट टाइप, और एंजियोडीमा ऑफ द लैरिंक्स, वो जरूर साथ में लिख देना. एंड इसमें देयर विल बी increased secretion. Increased secretion कहाँ की? There will be increased secretion, like there will be lacrimation will be there, sweating will be there, rhinorrhea will be there, and sneezing will be there, and even it is going to flare up the acne in the adolescents. So these are the side effects with this. Then next group of the drug is radioactive iodine. So one point which I forgot to tell you about this second group, thiamides. You are going to give this drug, but antithyroid drug immediately, but the clinical manifestation or effects, it takes around 1 to 2 weeks. उसमें आता है कई बार even it takes 1 to 3 weeks also. Now, why the clinical manifestation? It happens, there is a delay in the clinical manifestation because you have given the drug, there will be no synthesis, but whatever is stored, आपका ये follicles के अंदर जितना भी पहले ये, this is a thyroid follicle. So colloid, they are not very good diagram. So here is a colloid, pink color colloid. So T3, T4, they are already there. So that will be there, that will be released. So further hormone synthesis, that is inhibited, but the clinical manifestation between the administration of the drug and appearance of the clinical manifestation, or in that is, there is a gap of 1 to 3 weeks. The reason is because initially there will be release of the stored T3 and T4. Once this store get depleted, then only this group of the drug they are showing its effect. Then another one is the drug which destroy the thyroid tissue. इसमें सबसे important कौन सा है? The most important is iodine 131. Now how this group of drug radioiodine active, इसमें ये है कि radioactive iodine 131 in a form of sodium salt, we give it by oral route. So what it does, it is going to emit two type of radiations. It is going to emit gamma rays and beta particles. ये इलेक्ट्रॉन होते हैं. Now what is the role of this gamma rays? This gamma rays, it is going to traverse, it is going to cross that, ये वाला इधर ये जितना भी है ना आपका ये टिश्यू, इसको ये क्रॉस कर लेगा. Once you take this, and I told you it is radioactive iodine in the sodium salt of radioactive iodine that is taken orally, it is taken up by the thyroid gland. Then what will happen, it is concentrated here in the colloid. So this act within. So इसमें जो gamma rays है, this is going to traverse the tissue and we can monitor it, and this is we use this one for the traces study also. And this beta particle, this is the one. Okay. So what it does, this is going to emit this one from within. It is going to damage this thyroid follicle. जैसे ये वाला little bit थोड़ा सा इसमें. So this is going to, यहाँ पे अगर आपका iodine 131 है, so from within this, it is going to inhibit this single cell, all this cell. So it is going to destroy this epithelial cell. कितना? 0.5 to 2 mm. Itna tissue will be destroyed. Then what will happen? There will be pycnosis, there will be necrosis, and later on fibrosis will happen. So this is going to cause the partial ablation of the thyroid gland. So radioactive iodine, this is to be, इसमें आप देते कैसे हो? Usually we do the traces study, accordingly we see how much gland is there, how much dose is required. Usually 3 to 6 millicurie that is given, and the peak effect that is seen within 2 weeks. Okay, so effect starts within 2 weeks and peak effect that is shown after 3 months. तभी जब हम इसको देते हैं radioactive iodine 131 along with the carbimazole, what we withdraw that carbimazole over a period of 3 months. So by that time this radioactive iodine, they show their effect. So where we are going to use this radioactive iodine, so in the elderly patients जहाँ पे we cannot perform the surgery, already I have told, and how we give this one, that procedure also I have told. So radioactive iodine का क्या है, advantages क्या है, सर्जरी की जितनी भी कॉम्प्लिकेशन है वो नहीं होंगी, बट डिसएडवांटेज क्या है, इट इज गोइंग टू कॉज समटाइम्स परमानेंट, इट कैन लीड टू हाइपोथायराइडिज्म. ये हो जाएगा इससे, इट कैन कॉज द साइड इफेक्ट विल बी, इट कैन कॉज हाइपोथायराइडिज्म. फिर ये है कि वी कैनॉट यूज इट ड्यूरिंग प्रेगनेंसी बिकॉज इनफेंटाइल गॉइटर क्रेटिनिज्म इट कैन कॉज, यंग पेशेंट में हम नहीं देते. ठीक है. So these are the few contraindication of this. Now, another group of drug which I haven't written here, that is a beta blocker. Okay. Now what is the role of this beta blocker? or propranolol. They are mainly used in a thyroid storm. वहाँ पे देते हैं, and they are going to take care of the sympathetic manifestation of the hyperthyroidism. जैसे किसी को अगर है increased blood pressure, tremor is there, ठीक है, and palpitation is there, it is going to take care of all that. Then what else? It is going to inhibit the peripheral conversion of T3 to T4. Because of that, we use this one in a thyroid storm. Then sometime we give it along with iodine 131 also, because this is the one which is going to take the 3 months. By the time this drug takes its effect, we can put the patient on propranolol. Okay. Now the few words about the thyroid storm. So I told you this is a thyrotoxicosis crisis. It is an emergency. इसमें आपने पेशेंट को क्या करना है, यू हैव टू गिव मेक द पेशेंट यू सबसे पहले इसमें यू पुट द पेशेंट ऑन प्रोप्रानोलॉल 1 to 2 milligram IV you give, and a little bit symptoms control will be there, and then you put the patient on 40 milligram oral. इसमें आपने कार्बिमेजोल नहीं देना, you are going to give propyl thiouracil, because this is also going to inhibit, it is antithyroid drug. It also inhibits the peripheral conversion of T4 to T3. हमने ये एक्टिव वाला है, इसमें इसको कम करना. सबसे पहले आई आपकी ड्रग प्रोप्रानोलॉल. दिस इज नंबर 1 ड्रग. ठीक है. So number 1 is propranolol. Number 2 is propyl thiouracil. Then we give the corticosteroids. This also, जो भी आपके thyroiditis or anything is there, if there is any inflammation or anything, it is going to take care of that. And plus this also inhibits the peripheral conversion of T4 to T3. And then number 4 is, if there is any you can say arrhythmia, then put the patient on diltiazem. ये आप पेशेंट को दे दो. प्लस जो उसका वॉट एवर इज द सर्कुलेशन, उसका जो भी है इलेक्ट्रोलाइट बैलेंस, सर्कुलेशन एंड ब्रीदिंग, ऑल दैट हैज़ टू बी टेकन केयर. सो दैट्स ऑल. इफ यू लाइक माय चैनल, प्लीज सब्सक्राइब माय चैनल and put up the important suggestion in the comment box.